Welcome to the Art of Medicine. I'm your host, Dr. Andrew Wilner. Today, I have a very interesting guest, Dr. Olapeju Simoyan. Dr. Simoyan is professor of psychiatry at Drexel University College of Medicine, Philadelphia, Pennsylvania, and is board certified in addiction medicine, family medicine, and dental public health. She is the recipient of the 2022 National Humanism in Medicine Medal and many other awards. Dr. Simoyan also has an interest in the arts and music therapy, which is a topic I've been interested in for a long time. But before we get started, I'd like to thank our sponsor, locumstory.com. If you're considering locum tenens, either full-time or on the side, you probably have a question or two, or 20. Fortunately, locumstory.com has the answers you need. It's packed with unbiased information and advice from physicians. Locumstory.com has nothing to sell. It's simply an information resource. You'll find super handy tools that let you see locum tenens trends for your specialty and compare different locums agencies. There's even a quiz to help you decide if locums is right for you. Locumstory.com is the perfect place to start if you want to learn more about locums. That's locumstory.com. And now, without further ado, let's chat with our guest, Dr. Simoyan. Welcome to the Art of Medicine.
Thank you so much, Dr. Wilner. I'm so pleased to be here today.
Just tell us a little bit about yourself so we can put it all together. I was reading your background, and there's so many awards there that I decided not to list them. But the Humanism Award was pretty impressive. And so I want to learn about your medical background and then how you have mingled that, I guess, with the arts.
Oh, thank you so much. Well, yes, so my medical background goes back to way back when I graduated from let's see, I graduated from high school in Nigeria at the age of 15 and went straight into university. 6 years later, I was a dentist. Yes, you didn't have to get a first degree to go to medical or dental school. It was fashioned pretty much after the British system. And at the time, my parents wanted me to be a physician. There was a part of me that wanted to be a doctor, but I knew that I had all these other interests. And I, at the time, thought that, dentistry would give me more time, more time to pursue other interests,
Sounds like a rational choice. Yeah.
Yeah. But then I did that and kept wanting to do more. A part of me felt like I was also somehow responsible for saving the world, I guess. So I kept wanting to do more. And then I ended up coming back to the States, going to Johns Hopkins for a Master of Public Health degree, and I was thinking then I would maybe go work for the WHO or UNICEF and really save the world. And that didn't exactly pan out. So I ended up doing a dental public health residency at Montefiore in New York and stayed on a couple years with them. Doing research and and working in their school health program. And eventually I just thought, I decided to go to medical school. And
There's more to the body than teeth, it turns out, right?
teeth are very important, but there is more to the body than teeth. It's all, that's actually a whole other conversation about how people treat the mouth as if it's not part of the body. And that's a whole other conversation we can have some other time, maybe. Yeah, but I wanted to be able to do more, and so I ended up going to medical school at Penn State, Hershey, and fortunately, they had a very strong medical humanities program there. So we were required to take humanities courses, and we would have discussions about things like spirituality and healthcare, death and dying, caring for the poor, the history of medicine. They had the what they call the Doctors Kingsley Center for Humanistic Medicine that hosted a number of events, incorporating the arts into medicine and healthcare and so I had that exposure, and it just gave me, I guess, a nice introduction to how we could incorporate the medical humanities into what we do as physicians. And then we had one of the many activities we had was that we had a literary journal called Wild Onions, and it was led by students. And in my fourth year, I got to be the editor for that. It was an arts and literary journal. And so at the time, I just, thought it would be a fun thing to do. So I did it in my fourth year. And it turns out that several years later, when I was at what was then the Commonwealth Medical College, and it's now called Geisinger, it's now Geisinger's Medical School in Scranton, I started a similar initiative, which we called Black Diamonds. The students came up with the name Black Diamonds. Uh, that was a reference to the coal mining history of the Scranton area. And so we got, medical students, staff and faculty members to submit artwork, uh, poetry, narrative essays, and we started um, the journal called Black Diamonds, and I was the editor, and we had students involved as well. And our very first issue was funded by the Arnold Gould Foundation for Humanism in Medicine. So we're grateful to them. They gave us a start. And then after that, eventually the school thought it was important enough and decided to fund it on an ongoing basis. So I do have a long history with the Arnold Gould Foundation for Humanism in Medicine since my medical student days, and I'm just very grateful for the various opportunities that they provided.
You mentioned Black Diamonds and also the something about onions. So is that wild
Well,
onions?
so yeah, so Wild Onions was at Penn State Hershey, and it still exists, right? And then Black Diamonds was at Geisinger Commonwealth School of Medicine. And yes, and so I was a student editor of Wild Diamonds, and then I was a faculty editor in chief, founding editor in chief of Black Diamonds at Geisinger Commonwealth School of Medicine. And now I'm in Reading, Pennsylvania, and we started a very similar initiative called Silver Linings with Reading Hospital. So before we started Silver Linings, actually, somebody jokingly said he heard about wild onions and black diamonds and said something about how I was going up, I was going up the ladder or something or other, from onions to diamonds. So anyway, so now we have silver linings. Yeah.
Well, this program that we're recording now is going to be episode number 73 of The
Okay.
Art of Medicine. But in episode number 12, I talked to Paul Gross
Yes.
about pulse. I think
Yes.
it's Voices from the Heart. Is it
Of,
Voices
from the Heart of Medicine.
from the
Yes.
Heart of Medicine, which is also a creative
Yes.
journal with drawings and poetry and
Yes.
essays
Mhm.
that he does. I think that's is it out of New York somewhere?
Yes. Yes.
And these are all kind of semi or 100% volunteer efforts.
Yes.
But define humanism. What's humanism in medicine?
That's a hard one. But before we go there, actually, I'm involved in Pulse as well. I'm involved with Pulse. They have a new section called New Voices, and Paul and his wife invited me to be the editor of that new section. So I've been doing that for the last year, maybe a little bit longer now. So yes,
What's a new voice? Is that someone who's never published before, or
so
what's a new voice?
okay, so it's um, Paul's Voices from the Heart of Medicine. And then they have a section called More Voices. So for like really short essays between 40 to 400 words. And those are published on a monthly basis. And there's a theme for each month. And so with New Voices, we decided to just encourage people who haven't published. It doesn't mean that they could never have published before, but we wanted to hear from people who are potentially marginalized, haven't been heard from before, haven't had a voice, and give them an opportunity to share their experiences. And so far, we've had some very amazing stories, largely from medical students from different backgrounds. So it's been really interesting, and it's the sort of thing that I think is very rewarding. And it's just nice to give people an opportunity to share their stories.
Sure, sure. I think it's the Annals of Internal Medicine
Mhm,
or journal like that has like
mhm,
one page for the
mhm.
humanism,
Yes.
and I think I published there once when I was training. Because you
Mhm.
see things that they're just hard to come to grips with. As I mean, you do what
Mhm.
you can as a
Mhm.
physician, but
Mhm.
as a person, you see unusual things,
Mhm.
that
Mhm.
you wouldn't see in your, going to the
Mhm.
supermarket and filling up the car with gas, and going to the movies, and during your
Yeah.
normal life. In medicine, you have this window to some very unusual things. All right, so
Yeah.
let's seg over to music. Where does that come in?
All right. So so I always liked music, and a lot of people have the experience where they've had piano lessons since they were really young and that sort of thing. For me, I um so how do I put it? I was in a situation where I wanted piano lessons, but when I eventually got piano lessons, I ended up changing schools shortly after that, and then I didn't have piano lessons. Yeah, you know how that works. Um, but I never lost the interest. I never lost the interest, and I was in boarding school a lot. Yeah, I grew up in a diplomatic family. My parents were traveling, and we were in and out of Nigeria, and we were in boarding school. So it's like I ended up in a school where I didn't even have a piano to practice. When I was in school, I could only play when I was home on holidays. But like I said, I never lost the interest. And I remember one of my older relatives once asked what I wanted to be when I grew up. I was probably about nine-ish then. And, I said I wanted to be a pianist. And she just gave me this look and, that's a hobby, better think about a real job. So, yeah. So I thought about a real job and ended up becoming a dentist and then a physician. And then, yeah. But the irony of it all is that after all those years, well, I never lost the interest. So I would play on my own when I could. But I really wasn't making much progress, and I didn't really have the confidence that it would ever become anything significant. And you know what I mean. I thought I would just, play for myself and play for fun. And after all those years of training, I just ended up I kept wanting to, do more with music and learn more about music, and I started buying books and, reading about music theory, which I had never learned before. I So I eventually started taking lessons again after residency. So yeah, I started taking lessons again and learning more. And at some point, actually, before I went to medical school, I had started teaching myself the guitar, and I realized that all you needed to really know was a few chords, and you could accompany a lot of songs. And it just something just hit me then that I could do this on the piano. Why didn't somebody tell me this before? I don't always have to struggle to read to read sheet music, because I found that very challenging, and it's something that, I mean, I couldn't sight read, and it was always a challenge to, yeah, to learn, how to learn songs from scratch from sheet music. And then I realized that, yeah, you could just play a few chords and, and still make nice music. And then as time went on, so when I was in Scranton, I started taking lessons again, piano lessons, and eventually somebody at the medical school there was started a ukulele group. Um, so I think I joined them once or twice, and then thought, let me just go get a ukulele. So I started playing the ukulele, and of course, if you can play the guitar, you can easily learn the ukulele. At least that's my opinion. And then somebody in the community started a ukulele group, and I joined that group, and we started having performances like during the holidays or at nursing homes. And yeah, and so actually right now the piano and the ukulele are my primary instruments, and now I've been able to incorporate music into some of my work. So you mentioned music therapy earlier. So music therapy is an official profession, right? That I I'm not trained as a music therapist, and but many people are trained in that. But there are many of us who like to incorporate music into what we do. So I guess it's sort of called music medicine as opposed to music therapy. And actually, at my previous place of work, I remember once when I had sat in on some music therapy sessions, and then one week the music therapist wasn't available, and I wanted to see if I could run the session with the patients, and I wasn't allowed to for whatever reason. And I thought, really? So with all my medical training and my experience with music, I can't sit in for a music therapist on one occasion, and whatever reasons they had, maybe because I wasn't officially trained as a music therapist, they didn't think that whatever I did would count as music therapy. I don't really know, but I have found a way to do it. So in the sometimes I've had group sessions at an addiction treatment facility with teenagers and young adults, and then I give them a talk about the brain, the developing brain, the prefrontal cortex, and drugs, and all that sort of thing. And then I end it with music. So usually I'll pick a song and sing and play the ukulele. Sometimes if one of the patients wants to play, maybe they've composed, like there was this young lady who had brought her ukulele from home at her mother's insistence, and she had composed a song, while she was, and then she played this song, and she played and sang, so a couple of times we have the patients performing, but I think it really is an important part of the healing process for them, because for those of them that are musically inclined, and even for those who aren't musically inclined, just to hear me sing at the end of a lecture about the brain, they usually find it very uplifting, and yeah, and so I think that, there's been too much of a separation between the arts and the sciences. And this is one of the things I feel very, very strongly about, that we really, really need to bring everything back together again, and, this whole left brain, right brain dichotomy, we only have one brain. And it's supposed to work together, and the arts and sciences are supposed to work together, and yeah, so I feel that we can really use music, even if we're not necessarily trained music therapists, which I'm not. There are other ways in which we can incorporate music into what we do with patients, and even in professional presentations as well too. I've ended professional talks with music, and it's been really, really appreciated as well. So yeah.
Yeah, I think it's music is unexploited. When I was a medical student about 40 years ago, my psychiatry professor was a music file. In his home, he had about, those days people collected vinyl,
Yeah.
records.
Hmm.
He had an entire wall
Hmm.
of his home filled with these records, and he knew them all. They weren't just things he bought. He listened to them. And so when I would visit, I did a lot of house sitting for him because he had a piano there, and I used to
Yeah.
play a little bit. But I was able to learn some of the music. I'd play a record and I'd say, "Oh, that was conducted by this guy," and then play the same song and say, "Oh,
Hmm.
well, that was conducted by a different orchestra." So with training, you can really hear more.
Hmm. Hmm.
Then, you hear stories that people with Parkinson's disease, for example, they
Exactly.
can't
Hmm.
move, but they can dance, when they're, or
Exactly.
they can sing when they
Hmm.
can't talk. And
Hmm.
so there's clearly different pathways
Hmm.
in the brain, as well as I think the other issue is the emotional side.
Yes.
Music, somebody figured out that if you play music in the supermarket, people buy more. There's an emotional component to music. People cry at certain songs and,
Hmm. Hmm.
are happy. And of
Yeah.
course, a lot of illnesses put you kind of on the downside when it comes
Hmm.
to your baseline emotions when you're sick. And yet, we don't play music in the hospital. We don't offer it to patients. Here's your headset, play whatever you want. Some people bring their own, but it's not, no one has kind of recognized this as a legitimate therapeutic
Yeah.
modality. So, as a psychiatrist, you're a psychiatrist, right?
Actually, no, I'm a professor of psychiatry, but I'm not a psychiatrist.
Well, that's a nice trick. Can I be a professor of psychiatry too? I'm not a psychiatrist.
Well, it depends. It depends. So yeah, I need to clarify. So I did have some psychiatry training, but I left a combined family and psychiatry program to finish just the family medicine part. And
Aha.
but my primary faculty appointment is in the Department of Psychiatry with Drexel. So I'm a professor of psychiatry without without being a psychiatrist. So I'm board certified in family medicine and addiction medicine.
Ah, okay. So, as a professor of psychiatry who's not a psychiatrist, what do you think about the therapeutic potential of music therapy?
I I think there's so much that we need to explore, and there are people doing research in this area, but I think that I think we need a lot more. I think there's so much potential for music to to help people with healing, and you mentioned, earlier Parkinson's, they're researching, the impact of music on dementia, how people can't remember. They might not be able to remember things, but they can remember songs, excuse me. And then even for us as healthcare professionals, I was at Reading Hospital the other day, and then there's a piano in the hallway, like, in many other hospitals. And I heard somebody playing, and then I went over and talked to him, and it turns out he's a medical student. He's one of the Drexel medical students, and it was, to me, it was so uplifting, and I thanked him for doing that. And I've actually gone to the hospital a couple of times, like last year around Christmas time. I went and we just play Christmas music, and I don't even play that well, but I've learned to just get out of my comfort zone and just play, and some people would actually stop and thank me for playing, and I know that it was very uplifting. In fact, I remember back in the day when I was a resident, and I remember being in the hospital doing my OBGYN rotation and being in the hospital on a Sunday, and that one particular hospital had a player piano, so the piano that just plays itself. Doesn't need a human being to play it, And I remember just feeling like, oh, somehow listening to that music on a Sunday morning was just so uplifting, and it somehow made it okay to be at work, to be at work on a Sunday morning. And I know it might not necessarily have that impact on everybody else, but but music just, it uplifts us in so many different ways, as healthcare workers, but especially for our patients. I just think that there's so much more that we could do with music, and I really hope that that more research is done. I really hope that more research is done in this area, and that we can incorporate it more routinely into our work.
Let's touch on one more topic, and
Yeah.
that's what you're doing now, I believe, is addiction medicine.
Mm-hmm.
So that would seem to be, based on what I read in the papers, as a bonanza, right? The opioid addiction is a big problem. So you must have a
Yes,
lot of patients. Do you have a lot of patients?
it is. So right now I'm taking a bit of a hiatus. All right. So I was, up till a few weeks ago, I was the executive director for research at an addiction treatment facility. So we were actually focusing on research, but we obviously did have a lot of patients, and we were actually researching new medications, alternative medications that can be used for treating addictions, particularly opioid use disorder. Right now we have limited treatment options, methadone, Suboxone, buprenorphine, naltrexone, and particularly with methadone, there's a lot of stigma attached to it, and there's all these regulations and everything. So we do need to have additional options, and if we can identify other medications that can be effective, and that don't have addictive potentials and that don't have the stigma attached to them, then we'll give our patients more options, hopefully. Yes.
That's where
Yeah.
I went. That's where I was going with this. Is that there are
Yeah.
so many patients, we need to do something
Mm-hmm,
about it, because the problem
mm-hmm,
is opioids work really well, at least in the beginning. And so, I have lots of patients. I'm an epilepsy specialist, and they come
okay.
in and they don't really know what they're taking, and they're always running. I'm always writing refills for people running out. It's like nobody runs out of their opioids. I never miss a dose of the opioids. At least comparatively speaking, it's pretty rare because of the addictive potential, and these drugs do what they're supposed to do, but then they become medical hazards and lead to
Mm-hmm,
overdose
mm-hmm,
and
mm-hmm,
death. So there does have to be a solution. So it's great to hear that
mm-hmm,
there's some research ongoing.
mm-hmm.
Obviously better not to take them in the first place, and we've made
Exactly.
a lot of progress in that department. When I was in private practice years ago, we would prescribe opioids for headache.
Yeah.
That's off the table now. No,
Yes.
nobody does that. So I think the access, at least from the physician's
Mm-hmm,
desk, is getting lower.
Oh, yes, yes.
So that's definitely well. Is there anything else you would like to add before we wrap up?
Okay. Well, if you want to hear a little bit more about opioids, not so much about
Sure,
opioids, but
sure.
about some of the research that was done at the at the facility I used to work in, is that one of the projects involves developing a genetic like a genetic marker to identify who might be likely to develop an opioid use disorder if they're exposed to opioids,
So
right?
some susceptibility, genetic susceptibility
Exactly,
to, like there
exactly,
is for alcoholism, right? Some people are just
exactly,
much more
exactly,
likely to get addicted than others.
exactly. So we know that addictions in general do have a large components of susceptibility is based on genetics. But if we can specifically identify, look at their genetic profiles and identify who's likely to develop an opioid use disorder if they're exposed to opioids, then we can make better choices, and say, this person's at risk, so let's give them some non-opioid analgesics, and hopefully make an impact that way in reducing the number of people who end up getting addicted.
Right, and that would be a nice conversation to have with the patient as opposed to,
Exactly.
"Hey, doc, how come you're not giving me opioids?" It's like, "Well,
Exactly.
we did this blood test and we can see you're at high risk and you can understand that and your uncle died of, so you maybe get more buy-in from the patient side if you've
Yes.
got a data point. So would it be a blood test? Is that
It's
what?
actually, I was going to say that it's actually just an oral cheek swab, so even easier, less
Oh, so a
invasive.
DNA, it would be a DNA or an enzyme or maybe DNA?
So a cheek swab, what they would just look at they identify specific alleles that are
Yeah, so
involved
genetic
involved
typing.
in the
Wow.
reward pathway. Yes.
Pretty cool. That
Mm-hmm,
sounds good.
mm-hmm. Yes.
When can I do that?
I don't know
When
yet.
can I get one?
It's not available yet, so
All right.
fingers crossed.
Maybe at least in the foreseeable future, however, right?
Maybe.
Maybe. Yeah. Okay. Well, Dr. Simoyan, this has been great. Very interesting background you have, and your emphasis on the arts is certainly applauded from where I'm sitting.
Thank
So,
you.
thank you. And thank you very much for appearing on The Art of Medicine.
My pleasure. Thank you so much for having me, Dr. Wilner.
Oh, it's been fun. It's been fun. Well, before we close, many thanks to the Art of Medicine's wonderful sponsor, locumstory.com. If you're interested in learning more about locum tenens or considering a new full-time position, please go to locumstory.com. That's locumstory.com. I'm your host, Dr. Andrew Wilner. Thanks for joining the program. See you next time. This program is hosted, edited, and produced by Andrew Wilner, MD, FACP, FAAN. Guests receive no financial compensation for their appearance on The Art of Medicine. Andrew Wilner, MD, is Associate Professor of Neurology at the University of Tennessee Health Science Center, Memphis, Tennessee. Views, thoughts, and opinions expressed on this program belong solely to Dr. Wilner and his guests and not necessarily to their employers, organizations, or other group or individual. While this program intends to be informative, it is meant for entertainment purposes only. The Art of Medicine does not offer professional financial, legal, or medical advice. Dr. Wilner and his guests assume no responsibility or liability for any damages, financial or otherwise, that arise in connection with consuming this program's content. Thanks for watching. For more episodes of The Art of Medicine, please subscribe. www.andrewwilner.com